Hello and welcome to the channel. Today I'm going to be talking about dental and oral health problems that are quite common for women once they start going through the perimenopause process and all the years beyond that. So personally, I've never had particularly good teeth. In fact, since my early 30s, I've had a problem with my gums, which of course has a big impact on my teeth. So I've had, as you can imagine, quite a lot of painful times with my teeth and rather expensive trips to the dentist. As I went into perimenopause, I did notice that the deterioration in my teeth and my gum health seemed to have speeded up, and I wondered whether it was just, okay, so I'm getting older, is it just wear and tear, is it, just time passing by, or were the changes that were happening to my hormones making a difference? Were they actually making my dental and oral health worse at a faster rate than had previously happened before I went into perimenopause? So I had a look into it and I actually found it really quite interesting. So yes, your changes in hormone levels can and often do affect your dental and oral health, which when I thought about it does make sense, because when you are pregnant, if you've had children, if you're pregnant, in the UK, pregnant women get free dental health treatment, even if they've previously paid for it before. This is as it stands at the time of this video. They actually get free dental health treatment because they have got a higher risk of having dental and oral health problems because their hormone levels are in a different state than they were generally before they got pregnant. So I found that really interesting, and I thought, yeah, this really does make sense. So does that actually apply to the hormonal changes in menopause? And yes, it does. So I've actually made a note on the board behind me, which I will read through with you, about some common problems that women tend to find start occurring even if they've had really good teeth and gums before they started going through the menopause process. They often notice some changes, and obviously not ones that they would like either. So excuse me turning around. So some of the most common problems, this is not all of them, but some of them are tooth discomfort. Not necessarily toothache, but discomfort in the teeth and the gums, even if the tooth or the gums are not actually bad, there's nothing wrong with them. Nonetheless, they get a lot of tenderness and often sensitivity in the teeth, quite often for no apparent reason that they can see or that their dentist can actually see. So brittle and chipping teeth, yeah, that's quite a common one. So again, hormonal changes are not beneficial to the health of your teeth, so it can lead them to be more prone to breakage. Some of it may be wear and tear. Obviously, you've had your adult teeth for quite a long time and they've been put to a lot of use, obviously, over the years. So they do just get worn out, a bit like the rest of us. So discoloration and staining, again, that can just be linked to basically your age and the age of your teeth and use and wear and tear and how you've looked after them over the years. But it is really quite common to notice that there is more discoloration and staining once you get to the stage where you're actually going through perimenopause and, like I say, beyond. So loose teeth and a change in alignment. You may notice that some of your teeth are not quite so rock solid in the gums, and you may get a slight bit of movement there. And if you get more than a little bit, excuse me, of movement in your teeth, your teeth can actually move a little bit, so they become misaligned compared to how they were before. They can become a little bit wonky, and you can develop gaps in between your teeth where you didn't have them before. Excuse me. Dry mouth. Now, dry mouth obviously is something that we do associate with going through the menopause process, particularly in the post-menopause years, but it can happen at any stage, even from perimenopause onwards. So obviously when it comes to your oral health, dry mouth can allow a build-up of bacteria in your mouth. and that again can cause oral and dental health problems. And then we go on to gum disease. Now, gum disease is probably the biggie. So some of the other things you may notice could be down to wear and tear and just general use of your teeth and general aging of your teeth. Gum disease, again, I have suffered with that, like I say, since my early 30s, but it has actually increased since I went into the perimenopause stage. So when I went into perimenopause, I noticed that it was actually getting worse. So the thing with gum disease is you could have a mouthful of really nice white pearly teeth that look really healthy. You might not even have a filling, but with the gum disease, it undermines all that. So if you've got bad gums, then unfortunately you can end up losing your teeth, even though the teeth in themselves are healthy, because of the gum disease. If your gums recede, it lets in more bacteria, it loosens the teeth, and also it causes you a lot of pain. So it is actually possible to lose what you would think of as perfectly healthy teeth because of your gums rather than tooth decay. So I've got a few tips here. These really are just general basic tips, but they really do help. They are the basic tips really for taking care of your teeth, but also your gums, which is part of your overall oral health. So brush twice a day. Now some people say 3 times a day, but at least twice a day is the rule. So most people generally do it morning and evening. Always use a toothpaste with fluoride in. Fluoride toothpaste are really beneficial for your teeth. That is what the fluoride is in there for. So always make sure you've got a good fluoride toothpaste and brush at least twice a day. So I've written all surfaces. All surfaces might sound, well, yeah, I've got to brush all of my teeth, but it's so easy to kind of skimp a little bit, particularly if you're in a rush. Every single surface of your teeth, literally round all the corners, and don't forget your biting surfaces, that they're quite a common place where people don't concentrate enough because you think of the fronts and the back and then round the corner, but your biting surfaces are really important as well. So every single bit of your teeth needs to be brushed thoroughly at least twice a day. And then don't forget your gums. So your gums are really important. As I've just been talking about gum disease, you need to keep your gums clean just as much as you need to keep your teeth clean, and particularly the bit where your tooth is actually going into the gum. It folds over, doesn't it? So it can catch a lot of debris, which means bacteria can build up, and bacteria can mean decay. But when you clean your gums, you do need to be a little bit more gentle. You should never really over scrub your teeth really hard anyway, because you can wreck the enamel on them. So while you need to clean them thoroughly, don't go mad. And the same goes with your gums. Be a little bit gentle, but be thorough. Get that food debris off and bacteria that naturally builds up in our mouths anyway during the day. Get it cleared away. So again, twice a day, but don't forget your gums. And then rinsing. This was the thing I found a little bit odd. When I was a child, whenever we cleaned our teeth and you spit out the excess toothpaste and then you rinsed your mouth out with water. Apparently, rinsing your mouth out with water would not actually do your teeth or gums any favours, because you're rinsing away all of the toothpaste and the fluoride and so on that's in the toothpaste that is actually beneficial to you. So either only lightly rinse, or preferably, tripping over my words, sorry, don't rinse at all once you've spat out the excess toothpaste. I must admit, it does feel odd and it does make your mouth feel a little bit tacky, but after a few days you do actually get used to that, because leaving the toothpaste around your teeth and between your teeth for obviously longer time than you would if you were just rinsing straight away is actually really beneficial for the health of your teeth and gums. So yeah, don't over rinse. If you have to rinse a bit, just do it lightly. Leave as much of that toothpaste in there as you can. Getting enough calcium in your diet. Calcium is really important for the strength of your teeth, also your bones as well. You think of bones and teeth when you think of calcium. and not just when you're a child. Even in your adult years, you really do need to get enough calcium in your diet. That will help to keep your teeth strong and healthy as well. So keep an eye on your calcium intake. And then avoiding sugary and acidic foods, and also drinks. I haven't written that on there. Obviously sugary foods, bacteria love sugar, and acidic foods are not good at all for the enamel on your teeth, and if they wear away the enamel, then your teeth are more exposed to bacteria and tooth decay. So be really careful with sugary and acidic foods. Even if you do like a little something sweet, or something a little something sour, something acidic, it's really worth at least rinsing your mouth out afterwards, but preferably cleaning your teeth thoroughly after you've had that little treat. Now, big tip, obviously, and it's the standard one really, is regular dental checkups. You do need to see your dentist regularly. Don't skip your checkups, because they often spot something that is a tiny little problem that is, if it's addressed at the time, it stops it from becoming a big problem, and it will help you to stop losing a tooth or teeth. So keep your checkups regular. And if you're worried about anything about your teeth, if you're unsure, if you're getting extreme sensitivity, or you're not quite happy with a rough edge or something on your tooth, go and let your dentist have a look, because as they say, prevention is always better than cure, and a tiny fill-in or a coating or a little bit of treatment is much better than having a gap because you've had to have a tooth extracted. I have made a little note to myself here about your basic dental tools that you need, and they really are simple. So a small-headed but soft toothbrush. Now, it doesn't matter if it's a manual one that that you use yourself, or whether it's an electric one. If you clean your teeth properly and thoroughly, you don't have to have an electric toothbrush. You may prefer one, that's great. But don't have a really hard toothbrush, because that can damage the enamel on your teeth, and obviously it can also cause damage to your gums, which are more tender than your teeth are. Always a fluoride toothpaste. You don't have to buy the most expensive toothpaste, but it does need to be a good fluoride toothpaste. Dental floss is really helpful for cleaning the inside edges between your teeth. Sometimes it's difficult for even a really good toothbrush to get right in between your teeth. So flossing is generally recommended by your dentist, and it's very good for the insides of your teeth. For your gums that sit obviously at the bottom in between your teeth, you can use interdontal brushes, and they do come in varying sizes, from really, really tiny to obviously a little bit bigger if you have quite big gaps between your teeth. So it's really good because it gets at the gums in between your teeth. You do have to be gentle, and you never force them. If it doesn't fit between the tooth, do not force it, do not push it. But it's very good for helping the to get the dirt basically off of your gums that are in between your teeth. That can be really difficult to get, like I say, even with a really good toothbrush. So mouthwash is another thing that my dentist told me. Mouthwash can be great for freshening your mouth, and also for protecting it during the day. But just like not rinsing all your toothpaste away, you shouldn't automatically use a mouthwash as soon as you've cleaned your teeth, because again, you're washing away all that good fluoride toothpaste that you've just spent all that time and trouble getting around your teeth and using to clean your teeth and your gums. So I was told, and your dentist may tell you something different, but if you like to use mouthwash as a breath freshener, and to help protect your teeth, maybe in the middle of the day when you're at work, or to wash your mouth out with after lunch at work, then that's great. Keep your mouthwash for a different time of the day than the time that you clean your teeth. I hope you find the tips helpful. There was rather a lot there, but I hope you've found something in there that will help you. If you'd like to know when there's any more videos coming up on the channel, there is a notification bell below the video. There's also a subscribe channel there too. And in the description of this video, I've added a link to the full article that I've written about dental and oral health during the menopause. Thank you for watching, and I'll see you again soon.